everybody. This is Frances Cassavedice, President of the East End Chamber of Commerce, and it's an honor to welcome you to our COVID-19 business webinar. We're very honored to have Dr. Amelia Averti with Legacy Community Health talk to us about mental health check-in. All of us are feeling it. Most of us are working from home or staying at home with children. And these are some things that we've never had done before. And so we're very honored to have Dr. Averti talk to us today. Thank you for joining us today.
Thank you so much for having me. I'm very excited to be able to talk about this very important health consequence of COVID-19, and one that hasn't quite gotten as much kind of talked about as others up until this point. So thank you.
You're welcome. It's so true. I sometimes tell my family members that going to see a therapist is almost like going to a gym. It's healthy for your mind and body and soul. So it's nothing negative to think about. And so I'm so grateful that we're having this conversation. I'm going to let you go ahead and take it away, and then I'll be back to ask questions and answers. And please make sure that you put your answers in the Q&A section. Thank you so much, and take it away.
Great. So today we'll be talking about the mental health effects of the COVID-19 pandemic, and how they're really just affecting everyone. Everyone is feeling it, that's for sure. So as y'all well know, coronavirus disease 2019 may be stressful for people. Fear and anxiety about a new disease and what could happen can be overwhelming and cause strong emotions in children and in adults. Public health actions such as social distancing can make people feel isolated and lonely, and can increase stress and anxiety. However, these actions are necessary to reduce the spread of COVID-19. But coping with stress and other mental health issues in a healthy way will make you, the people you care about, and your community stronger. So that's what I would like to go over today. Oops, I'm gonna try to advance this. Sorry, everyone. So as we know, COVID-19 has caused problems in physical health, in economic stability, and in social connection, complete disruption for many. It has also caused significant mental health effects in the form of trauma, anxiety, and depression, among others. Today, we're going to delve a little bit deeper into these mental health issues, how they're affecting people of all ages, and how to identify them, how to best prevent them, how to treat them in home and in the community. So first, who is affected by the stress related to COVID-19? By this time, y'all all know that everyone is. How you respond to stress during the COVID-19 pandemic can depend on your background, your social support from family or friends, your financial situation, your health and emotional background, the community you live in, and many other factors. The changes that can happen because of the COVID-19 pandemic and the ways we try to contain the spread can also affect everyone. There are certain groups that may be at higher risk for a stronger stress response or more adverse health effects. Those include those that are at higher risk for severe illness, children and teenagers, caretakers for the elderly or other chronically ill, frontline workers, first responders, and I would argue people who have stayed at work throughout the pandemic, and those who are just now getting back into the workplace. Racial and ethnic minorities who have seen historic inequalities and injustices amplified and magnified by the pandemic. And also those who have had disruption to routines. So as is evidenced by all these high-risk groups, right? I think everyone can find a spot where they fit in. Now, how do these mental health concerns present usually? With every age group, there's a few unique characteristics to how mental health presents. In adults, it may be something we're more well experienced with. So this is concerns for depression. Symptoms may include difficulty sleeping, changes in appetite, changes in activity levels, lack of interest in previously enjoyed activities. It may present in the form of anxiety or excessive worry about multiple things, feeling on edge, anxious, like you got to run out of wherever you are, or even irritability and getting easily angered by things that used to just roll off your shoulders. There may be symptoms of post-traumatic stress disorder as well. These may include nightmares, invasive thoughts, trying to avoid certain topics or places because it reminds you of a stressful event. And then people are also looking for ways to feel better, which may lead them to unhealthier coping mechanisms such as increased substance use, whether it's alcohol, cigarettes, or other substances. And I want to emphasize too that we are not alone in this. Just yesterday, the CDC released a study that almost 40% of adult respondents to a questionnaire reported being affected by the pandemic in their mental health. And these percentages were even higher in those high-risk groups that I discussed on the previous slide. And sometimes too, it may not present in these kind of classic forms, but instead in very physical symptoms. I have had every day, multiple patients come in with new stomach problems, with new headaches, with new aching in their muscles, in their neck, in their back, in trouble sleeping, and even in the scarier symptoms of chest pain, feeling short of breath. And it's in those times that I encourage everyone to seek health care so that you can help distinguish between what is a mental health concern, what is a acute physical health concern, but oftentimes you'll find that it's tough to separate the two. Now, in teens, in adolescents, in children of all ages, mental health concerns may present a little bit uniquely, which I'd like to discuss now. In younger kids, they may present with excessive crying or irritation, clinging to parents or whining more, or even returning to behaviors that they had outgrown, like trouble with using the potty or wanting to use the bottle now instead of a cup. In older children and adolescents, it's almost more classic as in adults. So excessive worry or sadness, unhealthy eating or sleeping habits, maybe sleeping a lot more than they used to, or spending all day asleep and waking up only at night. Difficulties with focusing on whether it's tasks at home, homework assignments, online learning, irritability or acting out just for whatever reason. Why can I not get along with my kid now? And then again, they may reach for those substances as well. And if we do identify a problem, how are we supposed to cope? And how are we supposed to prevent these things from becoming a problem in ourselves, in our families, in our communities? The first thing that I'd like to emphasize is recognizing it, acknowledging it, and saying what you feel. Once you say it out loud, that not only sets the first step in place to treating the problem, but also engages those around you in a support system. It's important among families and then also communities, businesses even, to keep an open line of communication. As business leaders or employees, others may be looking at y'all to set an example of how to react to news, how to react to new regulations. And so it's important to stay positive and focus on what we know and what we can control. Along these lines, knowing the facts, sticking to CDC guidelines, and adhering to data-driven personal protective measures can help a lot. Again, recentering on what we know can help helps mitigate those excessive worrying and fears about the unknown, which we're all facing. So, you know the ones: social distancing, wearing a mask, frequent hand hygiene. And it's also important to encourage positive outlets and routines. These come in a large variety, one of which is limiting media consumption about the pandemic. This may be tough because every time you turn on a screen, there seems to be news about the pandemic. So maybe it's an hour or two where you just turn off all screens, get outside, read a book, do something non-electronic for some time. I encourage everyone to schedule some physical activity. It does not always mean exercising in a gym. It can be walking together outside. It can be stretching. It can be just outside deep breathing. But moving your body during the day will help mental and physical health. I also encourage you to schedule it. A lot of people may be working from home now, and so taking advantage of those times that we used to spend in the car commuting or other ways commuting, lunch breaks that we don't have to travel to get food. take some time to be physically active. And if you have kids at home that are virtual learning, working in some, PE hours, physical exercise hours can also help with their focus on their learning during the day. I encourage exploration of new relaxation techniques like deep breathing exercises, meditation, and these can be done in a few minutes sprinkled throughout the day to help us refocus and recenter. And then also not losing contact with loved ones and friends, but in a safe way, which can be with video chats, with texting, or even phone calls and letter writing. Old school, I know, but still helps maintain that connection. And then I also want to touch base on what to do if all of those measures just aren't working. I would encourage everyone to reach out to your family physician or mental health provider for guidance in these situations. There are also national and local organizations that provide various resources, including support groups and educational classes geared at helping families, individuals, communities with dealing with new mental health issues, one of which is the National Alliance on Mental Illness, the Houston chapter. Legacy Community Health also offers behavioral health resources for families and individuals during this time. That includes assessment, medication management, therapy, and testing for all patients, either in person or via telehealth appointments. We also recognize that sometimes keeping a healthy mind and body means assistance in other areas of life, including school, work, housing, economic stability, among many, many others. Our social work team is here all the time to help provide comprehensive services, including resource linkage, school advocacy, and connection to immigration and legal resources, just to name a few. And last but not least, it's important to have those emergency numbers on file, one of which related to mental health illness is the National Suicide Hotline. If you're afraid that you or anybody you know is having suicidal thoughts, you can reach out to this number, 1-800-273-8255, at any time during the day for children and adults. So be prepared, be open, and move that body during the day. And that's all I have for now. I'm happy to get to the questions.
Thank you so much. That was short, sweet, and very, very important. I can't tell you, I've been writing down notes of what I'm going to recommend to my family, and we'll start asking you some of the questions here. But one of the things that I've noticed is there's a lot of gyms that are closed, particularly the YMCA here, but they're offering online classes. Do you recommend families and businesses to incorporate that into their workday?
I think that's a wonderful idea. If the opportunity arises to work in some physical activity during the day, whether it's at the beginning, middle, or end of the day, it's a great way to energize the body and mind, as well as prevent some of these mental health issues we're seeing with the pandemic.
Thank you so much. And then I've got a question here. It said, can you talk about diet and the impact on mental health?
Absolutely, yes. And so when we think about diet and fueling the body, we oftentimes disregard how much our diet plays into our mental health and how we're also fueling our brain and our spirit, not just our muscles. And so making sure to have a regular diet, keep a good regular schedule. So we recommend at least 3 meals a day, maybe some healthy snacks in there, but focusing on whole foods. So lots of fruits, lots of vegetables, lots of whole grains and lean proteins can help keep you energized and avoid those roller coasters of energy and emotions during the day that are affected by kind of simple sugars, simple carbohydrates. I think another thing people are running into now, I know I have, is a dependence on caffeine now, and those kind of quick hits that we need just because we're not sleeping well, we feel run down. But using that kind of caffeine with caution, and then also getting back to how else do we get energy, and that's through those whole foods for sure.
Great. And I love the idea that you mentioned instead of commuting to work, use that time in order to exercise. And I personally have been doing that more often, Monday, Wednesday, and Friday, and just 30 minutes every day. And I've noticed such a difference. So I want to keep this up even after COVID goes away, because it's a time businesses are pivoting and they're doing new things. So we might as well do that for ourselves, mentally and physically. So if whatever is working now, let's maybe keep that up. Have you heard of things like that out there?
I have not so much, I mean, as kind of business goes, but I am excited about how we can reimagine the workday to keep our, colleagues, our employees healthy and happy and productive. And I think um, there's the research there for a long time about the use of mindfulness activities and then also physical activity during the day to help lead to a healthier workforce. And so now that we're reimagining where do we need to get work done, how much time do we need to spend in the car or in transportation, I think there's new ways to work those initiatives in across all different types of workplaces.
Great answer. And here's a good question. The stay-at-home work order has kept us inside with lots of screen time. What impact does excessive screen time on anxiety, mental health, et cetera, have?
That is a fabulous question. And again, it's yes, something everybody is dealing with. I think the most direct impact is that when we're on screen so much, we're on that kind of quick, you know, 24-second news cycle, right? And we're looking for updates. There's just a constant stream of information about the pandemic itself. Whether that information helps us feel more reassured or know the facts is not always the case. Sometimes it contributes more to the fear of the unknown, or you see those stories on social media, right, of kind of the more sensational ones about illness or recovery, and that can spark more fear and anxiety about the unknown. And then I think when we are more dependent on screens, we're also more sedentary. It's just tough to use a screen and move around. And that in and of itself can contribute to, mental health as well. So I mean, it's tough. I have to set an alarm on my phone, on my TV, on all of my screens, right? That, hey, you've been watching now, just like Netflix does. Hey, do you want to keep watching? But really take those moments every hour, every 2 hours to check in on yourself, take a break, step outside, get some fresh air and some sunlight. And then also doing it in a more cognizant way as well, because that time can slip by when we're just scrolling on the screens.
Wonderful. Here's another question for you. So how important is it to have an ergonomical workspace for everyone working at home? And what are some of the tips to have a better workspace at home?
I know that's something I'm struggling with too. If you were here, you'd see like my computer's now propped up on a notebook and a tissue box and everything. But yes, definitely. I think the more time we spend on a screen, the more important it is to position our body in a way where our skeleton supports everything as it was designed. If not, if we're having to hold uncomfortable positions over time, that can cause a lot of muscle tension, especially in the neck, upper back, and lower back. And so it's important to keep everything in a neutral spine. If you try to, I always like to check in every day, line up against a wall, put my heels against the wall, butt against the wall, upper back and head against the wall. And that's how it should feel when everything's in line, and getting your workspace to help you kind of maintain that alignment during the day can be very helpful, especially as we get to run the risk of having more muscle tension, muscle aches, which can cause headaches as well. So that's an excellent question.
I like that. So now when we're taking our deep breaths, maybe we can incorporate that with the wall, standing back. I'm now putting my shoulders back a
I
little
know,
more.
right? I had to adjust too. Uh-huh.
Yes, it's so true, so true. But I have another great question here. It seems that people are working longer work days versus the 8 to 5. What are some of the tips to keeping working hours and not letting work bleed into the evening?
Yeah, so that's tough now that we're all online and we have access to online. 24 hours a day. So I think it takes a whole workplace from administration, leadership, on down to employees to decide kind of new guidelines, work regulations about hours. So, setting even reminders on emails, right? To say, hey, it's after 5. I will have limited communication after 5, but I will be back in the office at 8 and ready to answer emails. But also being aware of scheduling, right? So not scheduling a big important meeting towards the end of the day where you know it's going to bleed into after hours. I think everybody at home, a lot of people are also facing new responsibilities, such as childcare, such as being teachers at home and being respectful and flexible in time that we expect people to be online. And I think it also starts with the individual as well, and being able to set those limitations and expectations for yourself before you can then advocate for them at your workplace.
Good point. Good point. Here's another good question. So, what are your thoughts on the blue light glasses? Should we be using those with so much online activity?
So the jury's still out on the effects of the blue light glasses. I know they're a little bit more expensive. I personally opted to not get them, but I have had some patients who swear by them. So especially if you're having kind of eyesight fatigue at the end of the day, headaches, especially towards the end of the day where you've just been staring at those blue lights, it may be worth a shot and see if that does provide some help. But again, I don't think any one solution is going to be the end all be all, but working in these different, how to lead a healthier online work life, I think is important.
Great. So, as we talked about, getting counseling and talking to a therapist is not a bad thing. It's a good thing. It's healthy. And some insurance have that incorporated into their insurance, and it's virtual now. But do you have ideas for any resources available out there for mental health support if one doesn't have coverage on their health insurance?
Yeah, so that is a very good question. And yes, and thank you for helping kind of normalize, destigmatize mental health and seeking therapy. I think everybody should meet with a therapist, just like everybody should meet with a primary care physician, at least touch and base, because there is no separating mental and physical health. They are one and the same. And so there's multiple for those uninsured or underinsured. There's many federally qualified health centers throughout town that offer behavioral health services. Legacy is one of them. We have services for people of all ages. There's also online resources for those with insurance, without insurance. There's a few websites I know of, which I do not have at the top of my brain right now, but I'm happy to provide those as well. So,
Good. We'll have this video, and then we'll have a presentation that you're going to provide to us on our website, and we'll also put those links of organizations that people can access assistance if they don't have that on their insurance. This is another interesting question. So I hear that one of the businesses that are thriving during COVID is the liquor stores, and they're essential businesses, so they stayed open. So can you talk about alcohol and COVID? I know everyone thinks that, oh, well, I'll just have one drink a day and it's every day. Can you just talk a little bit about that?
absolutely. So I think, yes, I hadn't seen those statistics, but I'm not surprised. I think everybody, one, is looking for a way to unwind, to relax, and then we're limited because we can't do other activities, or we think we can't. And so, yeah, that's not surprising. I think the first thing to consider when we talk about alcohol consumption is what is considered kind of moderate alcohol consumption. And so when we say one drink, right, in Texas, we like things bigger. And so a lot of people are surprised to know that one drink is just 1 ounce of liquor, 4 ounces of wine, or 12 ounces of beer. And so for biological males, no more than 14 of that size drink in a week is what's considered a moderate amount. and no more than 4 in one day, and then the half of that for biological females. So no more than 7 in a week and no more than 2 in one day. And granted, right, everybody's going to be different, and there's no kind of safe amount of alcohol consumption. Um, but things to be on the lookout for. So alcohol can definitely lead to kind of worsening exacerbations of feelings of depression and anxiety, and then worsening sleep problems as well, especially as our body gets more dependent, more used to it. And so if you've noticed those more kind of physical reactions that I just don't feel right if I don't have the drink at the end of my workday, or if you notice in a family member or colleague that they're talking about, needing more and more to drink to feel right, that's a time to raise a red flag and reach out for help. But yeah. Mm-hmm.
Thank you. Thank you. So we're wrapping up on our questions, but this has been so helpful. I feel like this is a therapy session for me, and I'm walking away with reading properly from now on. And I highly recommend that to my family and friends, but I'm going to even stress it even more so. Is there anything that we forgot to mention or forgot to talk about, or any words of wisdom or advice that you would like to help us close with?
I think, one of the things I have enjoyed seeing a little bit more with COVID is families getting out and about in the evening time. I know we're in the, heat of summer, and so making sure that we take safety precautions with heat advisories as well. But getting out, walking around outside is very therapeutic for mental and physical health, and can be done in a very safe way. So making sure that you're keeping social distancing when you do so. And if you can't, wearing a mask, but going to the park, even walking along the bayou, even around the neighborhood can be awesome. And it's safe to do that. So
And on that, someone just asked a great question. What are some healthy hobbies that you can do with a family other than walking outside in the park?
yeah, so healthy hobbies. What I have, any kind of hands-on activities kids are gonna enjoy doing. So like puzzles, coloring, things like that. I've also seen some recommendations as kind of like incorporating a little bit more journaling, and that way you can start those conversations around mental health topics with younger kids or adolescents, whether it's, a journalism story, have them kind of photo document what life during COVID is, how they've been feeling, things about that can be a good jumping off point for that. Even, writing a book about it, just kind of all that great creative outlets for, their mental health is really good.
I like those ideas, and I myself have started doing more audible books. It's just easier for me to listen and do other things at the same time, walking and listening. And so I'm helping de-stress myself and not watch a lot of TV, but yet get educated and take myself to another place since we can't travel right now.
Absolutely. No, and I would say too, taking the opportunity to do things you thought you never had time to do, like I'm a horrible cook, but I've at least tried to do a little bit more cooking, exploring those healthier, recipes, and getting kids involved in the kitchen, teaching them how to do, how to cook, how to take care of their laundry, all these other kind of adulting things. We've got a little bit more time, and so another option. But
Speaking of cooking, do you have some healthy snacks that someone can feed to their family? That was one of the questions we had here from Priscilla.
absolutely. So I think fruit is always a good option. Fresh fruit, not fruit juice. You want the whole thing. And then there's a lot of good recipes online too for colder snacks, even like frozen grapes for kids who can chew, not your infants, is a good refreshing snack. I think as long as it is, there's a go-to too for like some proteins like we find in nuts or tuna fish or things like that is also very healthy. But having stuff on hand and in kind of a portion that you think is reasonable. So having it divvied out at the beginning of the day, you know, if you're going to go for goldfish crackers, that's totally okay, but just making sure that it's, you know, a handful of them, maybe in a little Tupperware or a plastic baggie, so that you know when to kind of cut it off instead of finishing the whole bag without even realizing it.
Great, great tips. I love that. So wonderful. And it's been an honor to meet you on Zoom. You are at the Legacy location on what location are you at? If you can
We're on
remind me.
Lawndale.
You're on Lawndale. And there's other locations out there. So we hope that everyone will investigate, check out Legacy Community Health, and make sure that you make an appointment. And remember that mental health is okay to talk about. It is part of the normalcy. And we are just so grateful that you're a partner of the East End community and that you're a resource for everybody else. Any closing words before we say goodbye to everybody?
No, thank you so much for having me. I had a really good time, and I look forward to working more closely with everyone moving forward.
Good, good, good. Well, we'll be back again. Make sure that you follow us on social media. This is live. Tag other people that need to see this important document, and make sure that you reach out to our friends at Legacy. Thank you so much, Doctor, and have a wonderful week.
You as well. Stay healthy, y'all.
Thank you. Bye-bye.